The United States hospitals, medical schools, pharmaceutical giants, surgeons, physicians and psychiatrists lead the world. From cutting-edge surgical techniques, development of new vaccines to fight pandemics, discovering new drugs to defeat aging, and experiments with mind-altering psychotropic molecules, United States is among the unchallenged global leaders. Led by companies such as Amgen, Moderna and Johnson & Johnson, American pharma pushes cutting-edge developments daily. The US is also a heaven for foreign medical graduates, attracting thousands each year from India, Pakistan, Egypt, Syria and Lebanon. Almost 30% of its around 1 million physicians were born, educated and trained on foreign lands. No doubt, from the lens of many in the outside world, the American medical system is the best.
So because of this law, because of Obamacare, another 20 million Americans now know the financial security of health insurance. So do another 3 million children, thanks in large part to the Affordable Care Act and the improvements, the enhancements that we made to the Children's Health Insurance Program.
Every doctor wants to be part of its glitzy hospitals. After all, who would not like to work in world-renowned places like the Massachusetts General Hospital, Harvard Medical School, Johns Hopkins Hospital, and Mayo Clinics? American television romanticizes the endless nights with mind-numbing books and sleepless, stressful nights of medical students, showcasing their days as full of achievements, successfully able to treat every patient they want to, and romantic drama around every corner. Yes, Grey's Anatomy, I'm looking at you.
So pick me. Choose me. Love me.
But the reality being hidden by Grey's Anatomy and Chicago Med is chilling. Behind the facade of glittering world of American medicine lies a healthcare system driven by capitalist greed, avarice and insensitivity. A system broken and dysfunctional in all its forms and manifestations.
The present healthcare system is a disaster. It's disintegrating, and we don't need Band-Aid solutions. Private insurance companies, my friends, are not there to provide healthcare for you or for me. What they are there to do is to make as much money as they possibly can make for themselves.
Though if you do watch the show, New Amsterdam, you will find a greater focus on the more dysfunctional and quite sad parts of the job.
1%. That's how many doctors at New Amsterdam are in this room. Yet you prescribe 79% of the opioids here. And given that we are hooking patients by the thousands on drugs that are a molecule away from black tar heroin, can anyone tell me why you all shouldn't be arrested?
51% of Americans said they have delayed or skipped medical care due to cost. That number jumps to 63% among those living in a household with an income of less than $40,000 per year.
So here we are in 1993, 50 years after the chairman's father introduced the first legislation. We are still wrestling with many of the same issues and the same problems that previous generations have worked on. The difference is that today our system has many problems that have gotten increasingly expensive, and the difficulties of delivering health care in a cost-effective way is making a challenge to the fiscal integrity of the federal and state governments, to businesses, to individuals across the country.
Worldwide, the United States is the highest spending country with a healthcare expenditure of $4.7 trillion in 2022, which makes it around $13,500 per person. In contrast, the United Kingdom spends £282 billion, $358 billion, and approximately $4,000 per person. Canada spends $247 billion US and $6,400 per person. Despite this, US falls behind in most, if not all, indications of health quality. The United States, supposedly the heaven on earth, has the highest infant and maternal mortality rates of high-income countries such as the UK, Canada, France and Korea. With 5.4 infant deaths and 23.8 maternal deaths per 100,000, America leads the developed world from the bottom. Let it be clear, America cannot pride itself on comparisons with health systems in sub-Saharan Africa, India, Pakistan and Bangladesh. It has to be compared with the developed nations in the Western Europe, and there it falls flat. Chicago Med and Grey's Anatomy with its focus on good-looking actors don't fix that. The US also has the highest number of avoidable deaths in the OECD, the Organization for Economic Cooperation and Development. The OECD reports such a measure, which it calls avoidable mortality, defined as deaths before age 75 from conditions that are either preventable through effective public health and primary prevention, before the onset of disease, or treatable when they're detected early and effective care management is provided.
If you send me legislation that does not guarantee every American private health insurance that can never be taken away, you will force me to take this pen, veto the legislation, and we'll come right back here and start all over again.
Life expectancy within the US varies dramatically depending on where you live. In 2019, residents of 9 states, California, Colorado, Connecticut, Hawaii, Massachusetts, Minnesota, New Jersey, New York, and Washington, had an average life expectancy between 80 and 81 years. But even in these states, people can expect to live shorter lives on average than those living in most OECD countries. Life expectancy in most US states varies between 75 and 80 years. But in West Virginia and Mississippi, it is less than 75 years, below Mexico, the OECD country with the lowest life expectancy. So then why is it that despite having the highest expenditure per person throughout the world, that the US doesn't push ahead of other countries? Well, first of all, an estimated 30% of the US healthcare expenditure is simply spent on administrative costs, far more than any other country spends in the EU, and has no direct effect on citizens. This figure of administrative costs is 5 times more than what Canada spends, 8 times more than what an average EU country spends, and nearly 13 times more than what Japan spends, and amounts to more than 2 times what the United States spends on care for cardiovascular disease, more than 3 times than it spends on cancer care, and 100 times more than the Center for Disease Control's 2024 annual budget. Per capita, United States spend $1,055 on administrative costs. The next highest country to spend that much is Germany with $306 per capita. But this is not all. American citizens are also afraid of their physicians and insurance companies. Americans visit physicians far less as compared to other developed countries, but they pay higher costs for it. In 2010, working-age adults made an average of 3.9 visits to doctors, nurses, or other medical providers, down from 4.8 in 2001, according to a report by the US Census Bureau. Among those with at least one such visit, the average number of visits also declined from 6.4 to 5.4 over the period. In 2021, 10% of people ages 35, 44 haven't had a doctor's appointment in 10 years or more. 14% of Americans say they do not like visiting the doctor, with 5% saying they will only seek medical attention if it's a life-threatening emergency, citing, among other reasons, expensive co-payments due to poor insurance coverage and a lack of trust in medical professionals based on a past misdiagnosis. A family of 4 cannot hope to purchase a reasonable insurance package of for less than $1,500 to $2,000 per month. But even these figures that translate into $20,000 plus per year are only a mind game, because when the actual procedure is needed, huge co-payments make hash of all calculations. In 2022, 38% of Americans said they or a family member skipped or delayed medical care, amid the highest rate of inflation in more than 40 years, according to an annual healthcare poll from Gallup. This is a jump from 2019, when the same poll said 33% of Americans avoided medical care because of costs. Lower-income adults were more likely than their counterparts to delay care for serious medical conditions. Americans with household incomes under $40,000 were almost twice as likely as those making $100,000 or more to report that they or a family member delayed care for a serious medical condition. Compare all this to neighbouring country, Canada, and the differences start to puzzle you. Countries like Canada, France, and the UK have regulated industry prices for pharmaceutical products controlled by a government department, such as the Patented Medicine Prices Review Board in Canada, aka the PMPRB. After which, regardless of who the bill is being footed by, be that the government or private insurance, it remains the same.
Thursday, I'm going to ask Congress to immediately send me a bill to repeal and replace Obamacare.
The private plans, we're going to have maybe the health care savings plans, which are very good. We're going to get rid of the lines. You know what happens when you get rid of the lines? You have tremendous competition.
In the United States, however, pharmaceutical prices are regulated by the market economy and continue to hike higher. Because in a market economy, price settles at where feasibly the highest number of people will pay the highest possible price while still turning a profit. Supply of a product increases as the price of it goes up, while demand for a product decreases. However, in the case of medical demand, the reduction is not as pronounced because these are life-saving products, and therefore companies can charge higher prices regardless of whether the consumer wants to. They end up having to pay the high prices, especially for life-saving medications such as insulin or EpiPens.
Here in America, nearly 3 times, for the same drug, nearly 3 times what other countries pay. We have to change that, and we can. Let's do what we talked about for all the years I was down here in this body, in Congress. Let's give Medicare the power to save hundreds of billions of dollars by negotiating lower drug prescription prices.
In contrast to other developed countries, where the government has leverage to push down prices, as all the consumers the industry needs cannot be reached without the government intervention, the medical industry in the US has a guaranteed consumer base. Government programs such as Medicare and Medicaid receive the lowest prices because they have the largest consumer base and can therefore negotiate with the most power. Health insurances have some ability to negotiate prices, but considerably less than government programs because they have a smaller share of consumers and it's split between them. The uninsured individual has almost no negotiating power and often pays 4 times the amount someone on Medicaid would. Parts of payment that aren't covered by insurance are still typically high and keep increasing. Barring the tiny rich elite, most Americans are miserable with their healthcare system. Health is often a big political issue in election campaigns, but despite the promises often made, there is still no solution in sight. We need to find a solution. We need to fix it this election year. Join me on this channel to start this debate and much more about how the politics within the system affect us greatly. Biden was born in 1942. He is currently 81 years old. Trump was born in 1946 and is currently 77 years old. Both the current US president and the previous are part of the silent generation, placing 3 whole generations in between them and the generation currently entering the workforce. How can people who don't reflect the coming generation's views and opinions make the world better for them, while also being lobbied by industrial powers to do what benefits them?